Usually we have anywhere from 1 to 3 procedures per day. We fill out all the paperwork at the front desk, go over anesthesia concerns, and then they're admitted. First things we always do are physical exam, make sure everything looks okay, take their temperature, their vitals. Every patient gets an IV, so we have access to, if they need any medications, they can get it into their circulation as fast as they can. We have something called a pre-medication, so we give them that first, whether intravenously or intramuscular, just to help them relax. It makes everything go smoother if they can relax from the beginning. We have an induction where we give them, just like with people, another anesthetic agent to make them really sleepy so that we're able to put an airway tube in. We have to anesthetize them completely. You can't just do sedation because we have to protect their airway. There's a lot of water, we're cleaning. We have to intubate them, put an airway tube in, protect that, completely anesthetize them. That's a big deal and we take that very seriously. So that's why they have to stay the whole day. We hook them up, we monitor blood pressure, EKG, pulse oximetry, respirations, and tidal CO2. We're doing all of that just to make sure that they're as safe as they can possibly be while they're under anesthesia. We are really fortunate here that we have a board-certified anesthesiologist, Dr. Stephanie Fasakis, and she's involved in all of the anesthetic procedures here at Bulger, including dentistry.
I start by hand scaling the teeth, so that removes the large chunks of tartar. It just kind of flicks off like paint chips. Then we go in with the ultrasonic cleaning, and then I go in and I curette what's left. Curetting is one of the most important things in dentistry. You probably know from getting your own teeth done that when they go up underneath the gum line, they start scraping things away from under the gum line. But actually removing the start of the problem is really what gets you there.
We have an amazing dental x-ray machine here. We're really lucky. And it really, especially in cats, it helps us to decide whether or not to do extractions. And the fact that we do that, I feel like we provide the best care by being able to really assess. We have this x-ray to show, all right, it is really, really healthy. We can do these things. We can curette more, or we have antibiotic ointment that we can instill in the area and actually save the teeth. Versus on the other hand, if you have a tooth where it's really unhealthy underneath, that's probably causing discomfort. And we would never have seen that if we didn't take x-rays. So I feel really lucky that we do that on all of our patients. As soon as they are extubated, meaning we take out the airway tube, the anesthesia procedure is done, they're moved into the ICU ward, I will call the owner of that patient and let them know how everything went. If they do have to have extractions, they always get sent home with pain medicine. And then they're amazing. Even with multiple extractions, most dogs and cats are eating that night, the latest the next morning. And usually they're back to themselves by the next day. They're so tough, way tougher than I would be. Yeah.